Welcome back, viewers. I'm Dr. Rex and welcome to HealthConcern channel. In today's video, we will be talking about what the color of your pee reveals about your health. But before we begin, kindly use some of the time to subscribe to this lovely channel and leave us a like on this video to support the channel. Thanks for doing that. Now let's begin. Unless you're stuck in a car 100 miles from the nearest gas station. When you feel the urge to pee, you probably don't spend too much time thinking about your pee. But just like paying attention to changes in your stool, taking a peek in the bowl on your pee breaks can too. You've probably heard that the color of your pee can tell you how hydrated you are, but pee can give you other information about your health. Aside from the basic yellow hue, pee can actually come in a rainbow of colors, some healthy, some not healthy. In today's video, we'll tell you what these colors are and what they mean, from purple, blue, brown, black to green and more. Watch till the end to learn about all of them. Number 1. Orange. Just like your skin can skew orange when you eat too many carrots, so can your pee. Overdoing it means you've delivered yourself a heaping dose of beta-carotene, which is then excreted in pee. Certain meds or over-the-counter UT treatment, blood thinning, and some laxatives can also result in orange pee. The good news is you know you're taking these meds, and a good doctor will give you the heads up about color changes so you don't freak out. If you see more of a neon or fluorescent orange thug, something could be up with your liver, especially if you notice a yellowish tint to the whites of your eyes. Orange pee that skews slightly more brown could also be a sign of dehydration. Have you ever had orange pee? What was the reason for it? Tell us quickly down below in the comment section. Number 2. Yellow. Bright yellow pee is a sign of excess B vitamins in the body, including B2 and B12. Although this condition is harmless, taking B vitamin supplements can lead to pee of this color. The yellow color darkens as the concentration of the pee increases. Concentration refers to the proportion of waste products to water. The pee darkens as the concentration increases because the body takes in less fluid. It also happens if fluid is lost by other means such as sweating. People use the yellow in pee to indicate fluid balance in the body. It's also a reliable way to monitor hydration levels during exercise. Number 3. Clear. Clear pee indicates that you're drinking more than the daily recommended amount of water. While being hydrated is a good thing, drinking too much water can rob your body of electrolytes. Pee that usually looks clear is no reason to panic, but pee that's always clear could indicate that you need to cut back on how much water you're drinking. Clear pee can also indicate liver problems like cirrhosis and viral hepatitis. If you're not drinking large amounts of water and have ongoing clear pee, you should see your doctor. Number 4. Brown. One of the foremost reasons for brown pee is dehydration. Even a slight brownish tinge to yellow pee can mean you need to rehydrate with fluids. However, dark brown pee, rusty pee, or Coca-Cola colored pee can be a sign of ribomyolysis. This is a condition where your muscle tissues release a protein into the bloodstream, leading to possible kidney damage. This problem can be caused by severe injury, but today it's known for happening after particularly strenuous exercise, especially one that your body is not conditioned for, along with dark and pungent pee. Watch for muscle swelling and intense soreness. If you have symptoms of rhabdo, you need to call your doctor right away. Interested yet? Make sure you join our followers and hit that subscribe button for all our great HealthConcern content. Number 5. Red. This is one of the most important colors urologists worry about because they have to make sure that it's not blood first. Though it could be totally innocent. Did you go to a juice bar and order a drink made with beets? A small percentage of people have a genetic alteration that makes them more likely to develop red or pink pee after eating red-hued foods like beets, rhubarb, and blackberries. Another relatively benign cause is runner's hematuria. This is when the bladder rubs against itself as you run, causing the appearance of blood in the pee after exercise. If this happens to you, don't brush it off. Get checked out by your doctor to ensure that it is indeed what's going on. When there's red pee, it can indicate a problem with organs like kidneys, ureters, bladder, and prostate. If there is a problem with your peeing system, you'll likely experience other symptoms as well. For instance, if you have a kidney stone, you might also notice back pain in the area over a kidney, frequent urge to pee, or burning peeing. A peeing tract infection might also involve burning with peeing fever and peeing frequency. Prostate problems can come with visible blood in the pee, as well as a decreased peeing stream and having problems getting all of your pee out. When you go finally, red pee could be a sign of cancer. Bladder cancer is the fourth most common cancer in those assigned male at birth. It presents with no symptoms except for a few drops of blood in the pee. Having any visible blood in the pee warrants a call to your doctor to ensure it's not a UTI, stone or tumor. Number 6. Cloudy and foamy. Cloudy pee can be a sign of a peeing tract infection. Can also be a symptom of some chronic diseases and kidney conditions. In some cases, cloudy pee is another sign of being dehydrated. Cloudy pee with foam or bubbles is called pneumaturia. This could be a symptom of serious health conditions including Crohn's disease or diverticulitis. There are some cases where pee is foamy and doctors can't determine the cause. Pee that appears foamy or bubbly is typically the result of a very forceful pee stream that may mean pushing harder than usual to make pee flow, or even elevated blood pressure. If it persists over time, you might want to have a urinalysis test. Foamy pee can also be a sign of elevated protein in the pee, which can be a sign of a kidney problem. Number 7. Fluorescent. In adults, fluorescence is a hallmark of antifreeze poisoning and typically only lasts for a few hours after the poisoning under a black light. The pee of someone poisoned with antifreeze will glow blue if the sample is obtained in the first 4 hours after poisoning. In children, it can be suggestive of antifreeze poisoning, but oddly enough may be found in perfectly healthy children. It should not be used alone to diagnose poisoning in younger patients. Number 8. Green. Certain medications can lead to green pee, as well as eating asparagus. B vitamins can also lead to green pee color. None of these causes are that big of a deal, but green pee can also be a sign of a bacterial infection, which is worrisome. If it were a bacterial infection, you might have a fever and perhaps a milky appearance to your pee. See your doctor if you have any of these symptoms and your pee is green, whitish or milky looking. Number 9. Blue. This is most frequently caused by the presence of food dye. Strongly colored foods such as dark blue frosting can result in a pee color change, as can asparagus. Blue pee can also indicate the presence of a bacteria, leading to a very rare condition called porphyria, or dyes used for medical testing. Some medications are also known to cause a blue pee color. This is not typically a sign of a kidney problem, but may still be alarming to the unsuspecting patient taking these medications. There's also a rare inherited condition that increases calcium levels and causes blue pee. This is commonly known as blue diaper syndrome. Calcium is very important for your bones and general overall health, and you should always make sure your body has enough of it. Number 10. Purple. There is a very rare condition called purple pee bag syndrome that, as you might imagine, is typically found in people who have a Foley catheter to assist with pee drainage and collection. Oddly enough, the purple pee only happens when a patient has highly alkaline pee and a catheter in place. The pee doesn't actually change in color, it only appears purple in the collecting bag. If the catheter and collecting bag are changed, the pee again appears its normal color. Porphyria, a very rare condition, can also result in a purple color. Number 11. Black. Certain medications are known to cause black pee. The laxative sorbitol can result in black pee. Iron injections used to treat certain types of anemia can also lead to pee being black, but oral iron does not. Black pee disease is a rare condition in which the body cannot process specific amino acids. Number 12. Weird odor. There are many reasons that pee may have an odor. Dehydration makes pee stronger, which can result in an increased odor. Certain foods such as asparagus can make your own smell. There's also conditions that can result in unusual pee odor, such as maple syrup pee disease, which causes the pee to smell like pancake. Syrup sweet smelling pee may indicate diabetes. Musty smelling is often the result of liver disease or liver failure. Foul smelling pee is usually associated with the presence of a pee tract infection. In general, pee odor should be concerning if it persists without explanation, or is foul in nature if it's food-related or due to dehydration. It should pass over the course of a day as you drink water and the pee returns to normal. One of the most common causes of discolored pee is kidney trouble. What's the weirdest pee color you've ever experienced? Let us know in the comments section below. Thanks for your time. Don't forget to subscribe and like the video for more contents like this one. Bye for now.